Hello, we're Design Team 11, designing an improved way to expand tissues in pediatric patients. Some children have large birthmarks or scars on their faces. To treat these complex defects, pediatric craniofacial surgeons rely on tissue expansion, a two-step intervention that creates more tissue, allowing for the best functional and aesthetic outcome. In the first operation, a tissue expander, usually a hollow inflatable silicone balloon, is placed underneath nearby non-affected skin. Each week, a fixed volume of saline is injected into the expander through the port. Saline injections are usually terminated at 2 to 4 months. In the second operation, surgeons remove the expander and excise the diseased anatomy. In the United States, more than 4,000 pediatric tissue expanders are implanted into 1,200 children each year. All expansions require transcutaneous saline injections. There are two critical failure points. First, weekly saline injections are painful, scary, and anxiety-inducing for small children. These injections are administered weekly for 2 to 4 months, so they're not a temporary discomfort. The high frequency of these injections also makes children negatively associate their nurses and doctors with pain and stress. Second, for 80% of patients, the weekly saline injections are administered in the clinic. This means that the primary caregivers of patients must commute frequently to the clinic during normal business hours, which may result in a loss of income. They may stay and wait in the clinic for hours, even though filling the expanders only takes a few minutes. Some families who live far away from the clinic have had to completely relocate to avoid long commutes. From our root cause analysis, we believe that pediatric craniofacial surgeons need a less invasive way to expand tissues in order to reduce reported patient discomfort. By eliminating transcutaneous injections, requiring fewer visits to the clinic, and reducing complication rates, we hope to create an easier workflow for clinicians who struggle to treat their anxious patients and make tissue expansion safer and more comfortable for children who need it. Given our team's technical competencies in tissue engineering and modeling, access to expert clinicians, and in biomaterials research, plus our affiliation with the Johns Hopkins Hospital, we believe that we're well positioned to create a working prototype by the end of the design cycle. On behalf of the team, thank you for listening.